this National Cancer Control Plan outlines, details steps that everybody needs to take to address the cancer challenge, the increasing burden of cancer in the country. And we have several pillars in this National Cancer Control Plan. We're looking at avenues that we can address health promotion and cancer prevention. So we want to promote healthy lifestyles, and we also want to promote the message of cancer prevention, that is vaccination. Early detection is also one other pillar that we're talking about. But also we want to improve cancer diagnostics and treatment, at not just at the Cancer Institute, but other areas, as I will talk about later. We also want to improve palliative care. Given that majority of our patients come in stage 3 and stage 4, we want to make palliative care a part of our care, the continuum of care across the country for all cancer patients. Palliative care basically means improving the quality of life of those cancer patients that are under our care. We also have a pillar that looks at cancer surveillance and cancer research. We know that cancer research is actually the foundation of cancer care, and we want to strengthen cancer research, cancer surveillance in the country, so that we're able to better predict the number of cases. We know the associated risk factors much better, and therefore we can have better control measures. We also look at policy and advocacy, and this is where our colleagues in the media can actually significantly support us. We want to send the message of cancer everywhere. We need ambassadors of cancer in the whole country, so that everybody knows about cancer, knows what to do about cancer, and also works with us, partners with us, and civil society to improve cancer care and address these gaps that we have talked about. Like Dr. Mugisha mentioned, we also have sections of special populations. We have sections on children. We're talking about refugees, albinos, people living with HIV, because they have special needs or special effects that are affect them, that are related to cancer. And we think that we need to address them specifically. You need to address albinos specifically, provide them with the right messaging, and also provide them with the opportunity to come for early detection, screening. The services should be available when needed so that they can come for this. So the second component of what we're doing is the regional cancer centers. I've talked a lot about the geographic divide, and the Cancer Institute, the government of Uganda, has actually planned to decentralize cancer care from Lago to the rest of the country. In the National Development Plan 3, that's NDP 3, which ends in 2025, we have plans to set up 4 regional cancer centers in different parts of the country. So we'll have a Northern Uganda Regional Cancer Center, which will be situated in Gulu City in Omoro. And this Northern Uganda Regional Cancer Center is actually already under construction, and we expect that it will be functional beginning next financial year. That's 22-23. We also have a Western Uganda Regional Cancer Center, which will be in Mbarara, at Mbarara University of Science and Technology, as well as Mbarara Regional Referral Hospital. And this is already operational, but we're looking, it's operational in a structure that was given to us by the hospital, but we're looking for funds to actually expand this into a fully fledged cancer care center. We have the West Nile Regional Cancer Care Center that will be in Arua, and this is also operational, again in a structure that was given to us by the hospital. And we're also hoping to get funding to expand this. And we also have an Eastern Uganda Regional Cancer Center in Mbale with Mbale Regional Referral Hospital. And again, we have a structure here given to us by the hospital that we're renovating to actually operationalize that. The goal of this is that people no longer have to travel very long distances to access cancer care. Cancer care will be in their backyard, and it will shorten the time that they take from either diagnosis or symptom recognition to actually going for specialist cancer care. And our hope is that after setting up these regional cancer care centers, we'll actually have these as coordination areas to coordinate the regional hospitals, the district hospitals, so that you have these prevention and early detection services at the lowest level, rather than having all the cancer care centered in Kampala.